Prynawn da pawb, and thank you, Nicola, for your invitation to speak at this conference. I very much appreciate the relationship we have with presidents of ADSS Cymru and our very frank discussions. I joined the social care family almost by the back door in 2010 when I became the chief executive of Cafca's Cymru and saw firsthand the dedication and hard work which goes on to support some of the most vulnerable children in Wales. I've now been Chief Inspector of Care Inspectorate Wales for just over 4 years, and it's been an incredible privilege. Rewarding, frustrating, exciting, challenging, and heartbreaking, often all on the same day. I've enjoyed the sessions in your conference that I've been able to get to so far and welcome this opportunity to be able to publicly thank you all for your remarkable work in this strangest of years. Extraordinary times bring out extraordinary responses in people, and at Care Inspectorate Wales we have been so impressed by the selflessness and heroism of the many, which throws into sharper relief the actions of the very few. It's all too easy to agonize over the what ifs and if only we knew then what we know now. But I want to start by sharing some of the positive and innovative examples from the first wave of the pandemic and how these are making a difference and have made a difference to the people working in and accessing care services across Wales. Let's start at local authority level and the strong leadership exhibited by ADSS Cymru in championing the voice of people and of providers. So, for example, insistence that directors of social services are involved in incident management team meetings whose decisions impact on the lives of so many people. The way the private sector and local authorities have worked together to provide emergency COVID provision, with the private sector often providing the premises and local authorities and health boards providing the staff. The significant contribution the third sector has made to supporting people's well-being during the pandemic. And local authorities should be commended for the innovative ways they've stayed in touch with children and young people, ironically many of whom prefer virtual contact to a face-to-face meeting, as this is their usual way of keeping in touch with friends and family. And we've heard much praise from care leavers for the support provided to them, in particular by their PAs. But it is important to recognise the pressure on unpaid carers who have stepped into the breach and carried on without the usual much appreciative support of day services or short breaks. And then some of our risker providers who've been purchasing tablets so families could keep in touch with their relatives virtually via Skype and FaceTime. And for those who couldn't access digital services, sending of photographs and cards to family members or arranging telephone calls. Providers who've arranged visits in car parks for residents and their loved ones, including a really difficult, a couple who'd been married for 60 years and had never been apart in that 60 years until the pandemic hit in March. Our childcare and play services report about the support they've received from local authorities and in particular the Family Information Service. But one was really struggling, felt very isolated. She was looking after the child of a key worker. She was homeschooling her own 2 children. And we suggested that she contacted Pacey, the umbrella group, and mentioned to other childminders in the area during our check-in calls what was going on. She linked into this group and felt support and had an opportunity to share her concerns and learn from others. And then on a very small but practical level, the providers weren't sending home any children's creations, and it was sad that they couldn't. And we shared what others were doing, keeping the work separate in a plastic wallet and then sending it to parents after it had been in the plastic wallet for a week. And the provider was relieved that they could do this. And who doesn't want their children's artwork, particularly at these times, to be displayed on their fridges? And these are just a smattering of the very encouraging stories that we've heard and seen over the last few months. And it's clear from these examples that you are making a real difference to the lives of so many by working together and finding creative and innovative solutions to the challenges we face. COVID-19 is a terrible and devastating virus that has impacted our lives in so many ways. But it does not and cannot excuse forgetting the basics of good quality care. No one in 2020 should die with pressure sores covered in their feces. No one in 2020 should die in pain because their end-of-life drugs were not collected nor administered. We all have a duty to the most vulnerable in our society, and by all of us continuing to follow guidelines around social distancing, hand washing, good infection control, appropriate use of PPE, we can all continue to reduce the risk of transmission and the spread of the virus. It seems like a lifetime ago, doesn't it, that these guidelines were put in place, but they are as important now as they were right back at the beginning, and we must not lose sight of their importance in our fight against the virus. So many of you continue to be absolutely exemplary in this, and I do want to stress that, and you are to be commended and thanked. But what we're finding, along with our fellow regulators across the United Kingdom and Ireland, who we meet and discuss these issues with regularly, is for a very, very small number, there is an element of complacency which has led to a neglect of some of these basic principles. So in terms of lessons learned, we have all learned so much from our experiences over the last 8 months, and are using this to inform our approach during the second wave. And I suggest life is likely to never be quite the same for any of us at the end of this period, because much of what we've learned will continue to be a feature of how we work in the future. And some of our learning comes from our involvement with the new inquests resulting from tragic and sad Operation Jasmine, which are scheduled to take place in January and have actually helped us in our response to COVID-19. And in particular, what we've learned is the importance, the pivotal importance of information sharing and cooperation between agencies, clear escalation processes, and an explicit audit trail of decision making, with decisions not just about why we did certain things, but also why we didn't do certain things, being equally important to record and capture. For us, lessons we've learned and will take forward to this next phase of the pandemic and beyond are: people receiving services need to be at the heart of all our decision making. Partnership working is key to supporting improvements. We like to think that we had already built really positive relationships with colleagues in local authorities and providers before this. But our view is that these have got significantly stronger during this very difficult time. Co-production at its finest, and we certainly would not want to lose that. The ability to have virtual attendance, for example, at safeguarding meetings means our spread is wider, and the value and importance of good ICT systems and our online service. Our information team daily produce reports based on notifications received from services which provide vital information about the spread of the virus in care homes, the impact on local authorities and on childcare and play services which closed during the pandemic. And that might sound sterile, but trust me, nothing focuses your attention and determination more than to start your day looking at notifications of deaths from COVID-19 in care homes, recognising that each of those numbers represents an individual, their family, and their friends. And we've also been able to develop new online notifications specifically for COVID-19 and are continuing to modify and develop CIW Online, both to make it easier for providers to work with us in the future, but also to inform decision-making about the virus and how we deal with it. We've been trialling virtual inspections specifically for COVID-19 and some virtual tools that can help us to engage more effectively, and we're looking as to whether we will continue to use those in the future. But there is no substitute for crossing the threshold to see, hear and feel the nature of a service. We've wrestled with lots of issues during the pandemic, but one of the most thorny has been in connection with visits to care homes. It's such a complex conundrum, trying to ensure the balance between all of our desire to protect the most frail and the most vulnerable, whilst respecting and recognising people's need and desire to be with those they love and that matter most to them. So we work closely with Albert's team, with Care for Wales, with ADSS Cymru, with the Older People's Commissioner to help develop guidance for providers about safe visits to care homes. Such impossible choices, but at the heart of this is the recognition these should be decisions that should not be done to someone, but done with people and their families. Back in the very early days in March, and sometimes I think back about them and think I can hardly believe what it was like then. But back in those early days, we were asked why we weren't insisting, I think it was about the 2nd, the 5th, 6th of March, why we weren't insisting visits should take place to care homes. And frankly, our view then was we just didn't know enough about the virus. We didn't know enough about transmission, who knew what asymptomatic meant, how do we prevent infection, and there was the whole issue around PPE availability. Now, with all we have learned, we would encourage that we all do what we can to make sure people living in care homes can safely meet their loved ones. And I think all of us have recognised the importance of folks seeing their families for their own health and well-being, and so many creative solutions to help achieve this: gazebos, pods, temperature checks, risk assessments. I don't underestimate the amount of work and the logistics it takes to make these visits happen, but so important that this continues. We've also been looking at balancing rights and responsibilities, and in September we published a summary of feedback from the registered social care sector about their experience of COVID-19, and key findings included the importance of a rights-based approach, ensuring people receiving social care and their families or advocates are involved in decision-making, recognising providers are partners in care, especially in relation to hospital discharge, as are family members for many people. And there are some lovely examples of that happening. One person had slept on a sofa in the lounge for their whole life, and when she moved into a service, she wanted this to continue. And we all have, don't we, our individual ideas about our home and home life and basic needs and requirements. And it would have been very easy for a service to just expect the lady to conform to a standard arrangement, but they didn't do that. And after risk assessments, furniture was obtained and provided by the service, which allowed her to continue to make her bedroom look like a lounge, with a bed being made up on the sofa every evening by support staff and then packed away. It sounds a small thing, but it demonstrates such an understanding of her right to have an adequate standard of living and what this standard meant to her as an individual. And it's also been so encouraging to hear how many young people in care homes have actually thrived in these extraordinary and challenging circumstances, possibly without the distractions and pull of the outside world, but how relationships with other children and staff in the home and with their social worker has prospered. Good quality care and support considers personal wishes, aspirations and outcomes. And those are just some examples of provisions and adaptations which meet people's individual needs and involve them in their care and deciding how they want this to be delivered. And just looking ahead are some of our main concerns for the next 6 months, because as always, amidst the extraordinary and the exemplar, there are a number of things which are concerning us. The longer-term sustainability of the sector, financial and staffing challenges, the impact on health and well-being of adults and children who've been locked down, particularly those who've not seen family and friends now for many months. How do we provide assurance about the safety of services, particularly if the amount of physical access is so greatly reduced, and what will be the longer impact of that? How do we balance the need between making sure people are safe and happy with the desire to support the sector? In the first wave of the pandemic, a global shortage of PPE caused untold stresses and strains. We didn't understand how the virus spread. We had limited access to testing. It was a very, very difficult time. But we astonishingly and rapidly adapted and evolved our services and how we work. We now understand how rigorous IPC needs to be, and we can never afford to let our guard down. No matter how tired and in need of some human contact, no one should forget the basic social distancing, even on their breaks, and simple hand washing, so essential. We were zealous at the beginning. We absolutely need to continue to be zealous now. But I can't commend enough how incredible social care staff have been throughout the pandemic. Stories of the loving tenderness showed by staff to people who died with no family member present. People moving into care homes, living in caravans in the garden to protect residents and their own family members. Strong relationships maintained and improved by social workers with vulnerable adults and children. So many acts of compassion and dedication. But the worry is, perhaps due to ongoing pressures, that for a small, and I must emphasize, a very small minority, some of the basics are sometimes being forgotten. And this, I guess, is my biggest worry, which is the resilience of the sector. Folk are tired. I'm tired. I'm sure you're tired. We're all tired. And we're all dealing with anxieties, concerns and pressures, both in our work and home lives. So I've got two questions for you. The first is, how can we as a regulator best support the resilience of the sector? And secondly, which is for all of us, is what can we all do to support the well-being of our staff through the challenges of the winter? And I just want to conclude by personally thanking you all on behalf of Care Inspectorate Wales for your dedication and commitment. You have shown great resilience in the face of unprecedented challenge, And sadly, I fear there's more to come. We have learned so much already, and we must ensure we continue to adapt and take forward these new ways of working, particularly how we collaborate and work in partnership together to manage the impact of the pandemic and what comes after. We recognise the significant pressures local authorities, social care and childcare and play services are experiencing, and we do not wish to unnecessarily add to this. But as the regulator and inspectorate, we must also continue to provide assurance to the people of Wales and Welsh ministers about people's safety and well-being. People understand the value of childcare. Everyone uses and appreciates healthcare, but social care, until you need it, you have no idea how invaluable a service it provides. Wouldn't it be extraordinary if the focus there's been on social care during these last very difficult 8 months translates into an ongoing shift in perception, recognition, and appreciation for the vital but too often unsung role social care plays in our communities. Thank you, Nicola.
Diolch, Gillian. Thank you. That was really quite emotional. And I would like to take the opportunity to thank you and all of CIW colleagues who have changed their roles and done things differently to support the wider sector throughout those difficult months as well. So it's been a challenge for all of us, and CIW certainly stepped up and into different roles to assist. So thank you for that. I agree. I think relationships have become stronger, and I really hope that that strengthened relationship continues into the future. Okay. I've got just one question for you, Gillian, and I think that's probably all we've got time for. Obviously, we talked a lot about the interaction between CIW, local authorities and care providers.
Yes.
But would you say that COVID has changed the way the public interacts with Care Inspectorate Wales? Do you think there is now an increased awareness of your role, of the role of the regulator?
I think it's probably too early to chart that, because I think what we've seen is, as you know, we map the concerns that come into us, and they have increased by about 15% over this period. We map telephone calls, which have also increased. I actually think that the public was so stunned during that first phase that this tsunami of issues I was actually expecting. So, for example, when people weren't able to see their loved ones, I was expecting a huge public outcry. But I think people recognised the conundrum and also wanted to keep people safe. So I think the full extent of the change with the public has not happened yet. And I think as folk move out of the shell-shocked nature of what has been, we use the word unprecedented regularly. This really is unprecedented, isn't it? And I think I'm expecting things to shift over this next period. I hope that people begin to value the whole impact that social care has, and certainly our role as the regulator, because actually, if that doesn't change, it would just be the saddest part of the pandemic, that all this focus, all this attention, and then life continues. But I think let's see what the next 6 months brings, Nicola. I think the winter is going to be a very different story for the public's perception and the public's restlessness